Presenting on Prinzmetal's, also known as coronary artery spasm, a specific cardiovascular pathology that fits directly within our unit on physiological systems, specifically the cardiovascular system. So define and explain the condition first. Prinzmetal's is defined as episodes of myocardial ischemia, reduced blood flow to the heart muscle that occur typically at rest, are not necessarily related to physical exertion or atherosclerosis, and are caused by dynamic constriction of a coronary artery segment. This constriction is a functional abnormality of the smooth muscle layer of the artery wall, not a fixed blockage. It is a condition characterized by sudden, severe chest pain caused by temporary tightening spasm of the heart's coronary arteries. Unlike typical angina caused by plaque buildup in atherosclerosis, Prinzmetal's occurs when the smooth muscle in the coronary artery walls involuntarily constricts. This spasm reduces blood flow to a part of the heart muscle, leading to ischemia, lack of oxygen, and causing the chest pain. The spasm is usually temporary, and blood flow returns to normal once the artery relaxes. It often happens at rest, particularly during the early morning hours. It's important to distinguish this from angina caused by narrowed arteries due to plaque. Prinzmetal's can occur even in people with normal or near normal coronary arteries. Next, mechanism of injury, disease process. Endothelial dysfunction is the endothelium, the inner lining of the blood vessel, is impaired. The endothelium normally produces vasodilators like nitric oxide that keep arteries relaxed. In Prinzmetal's, the function is compromised, leading to an imbalance favoring constriction. And smooth muscle hyperactivity. The smooth muscle cells in the coronary artery walls are excessively sensitive to stimuli that cause contraction. This can be triggered by autonomic nervous system imbalance. Spasms often occur at rest, particularly early morning, aligning with circadian rhythms influenced by the sympathetic and parasympathetic nervous systems. Other local factors are magnesium deficiency, increased calcium influx into the smooth muscle cells, or sensitivity to certain substances, which are sometimes used diagnostically. Comorbidities. While Prinzmetal's can occur in people who are otherwise perfectly healthy, it is frequently seen alongside conditions associated with certain other conditions, So, while it's not a strict requirement that a patient must have comorbidities, they frequently do. Some associated conditions are migraine headaches, Raynaud's phenomenon, cigarette smoking. While often considered a risk factor, heavy smoking can also be viewed as a coexisting condition impacting vascular health. Risk groups. Prinzmetal most commonly affects individuals younger than 50 years old and are more prominent with women. If a patient also has underlying coronary artery diseases, their risk of major cardiac events like heart attack is higher. Prinzmetals can coexist with or be exacerbated by atherosclerosis. It is often seen in patients who are otherwise healthy with few traditional cardiovascular risk factors like hypertension, hyperlipidemia, or diabetes. This is a key differentiator from typical atherosclerotic angina. Prinzmetals is often a condition of vasospastic reactivity rather than degenerative plaque disease affecting younger individuals, particularly women, and sometimes those with other conditions related to vascular reactivity or autonomic function. Treatment. The main goal of treatment is to prevent or relieve the coronary artery spasms and alleviate symptoms. So one option is calcium channel blockers. These are considered the first line treatment. They work by relaxing the smooth muscle in the artery walls, preventing calcium from entering the muscle cells, which inhibits contraction. This directly counteracts the hyperactivity in Prinzmetals. Also, nitrates, like nitroglycerin, often used for acute symptom relief or as an add-on therapy. Magnesium has been used in some acute settings, as magnesium deficiencies can be a trigger for vasospasms. Treatment focuses on vasodilation to counteract the artery's tendencies to spasm. Calcium channel blockers are the cornerstone because they directly address the smooth muscle dysfunction underlying the condition. Other lifestyle modifications could include smoking cessation, crucial if the patient smokes, as smoking can worsen endothelial dysfunction. Stress management, since stress can also be a trigger, and managing stress is important. The outcome. With appropriate medical management, particularly with calcium blockers, the prognosis for Prinzmetals is generally good. Many patients experience significant relief from their chest pain and can lead relatively normal lives. Reoccurrence could occur, spasms can be reoccurrent, and treatment often needs to be long-term to manage the condition effectively. Adherence to treatment. Patients who consistently take their prescribed medications tend to have better outcomes. Complications, while often benign, severe or prolonged spasms can lead to serious complications like myocardial infarction, like a heart attack. If the spasms is severe and prolonged, it can cause significant heart muscle damage. Reduced blood flow can disrupt the heart's electrical rhythm. And sudden cardiac death, although rare, it is a potential outcome in severe unmanaged cases. Also, diagnosing Prinzmetals can be tricky because standard stress tests like treadmill tests might be negative if the spasm doesn't occur during the test. Diagnostic methods like coronary angiography are often needed to confirm it. Because the arteries often look normal on initial examination, patients might initially be misdiagnosed with less serious conditions, leading to delayed treatment. These are my sources.